Good evening. Welcome to our weekly interview program, Sightline. Our guest is a clinical professor in mental health care at the University of Essex in England. Thank you, Professor Fiona, for accepting our invitation.
Thank you, it's a pleasure to be here.
Can we talk about the broad mental health issues in general before we start focusing on nurses' role in mental health care and your training programs that you're leading currently in Mongolia?
Sure.
Mm-hmm. So, what are some of the differences between Mongolia and Britain in terms of mental health care?
Well, there are two primary differences which lead to a lot more. The main difference is, of course, resource, so the government spending. And Mongolia, as a low middle income country, spends a lot less on healthcare generally than the UK as a developed nation. So I think in the UK it's about between 9 and 10% of GDP is spent on healthcare, whereas in Mongolia it's less than 2%, which is the average for the income of the country. So that, of course, leads to a disparity in what's available in terms of resource. So that's the main primary issue, and then it's where that resource is spent. So in the UK we have a lot more community services and home treatment, and that hasn't been developed as yet in Mongolia, particularly in mental health. So those two main areas are what I see as the primary differences.
Interesting. So 2% is quite low.
It's the average for the income of the country, actually, but it still is very, very low in relation to what's made available for patients and what staff can work with.
What are the most significant mental health issues in Mongolia, and what do you think, what factors are causing those problems?
Well, I think Mongolia, like everywhere in the world, has high rates of mental illness, and predominantly anxiety and depression seem to be the most prominent. It's difficult to get exact figures for the prevalence of each different illness, but there's been definitely an increase in Mongolia over recent years in rates of alcohol abuse. Suicide rate in Mongolia is very high. It rates at number 40 to 43 in the world, I think, among 183, which has gone lower over the past 6 years, but it's still very high, particularly among young men. The rates of loneliness, isolation, and urbanization all contribute to anxiety and depression. And in young people, there seems to have been a recent increase in Mongolia in self-harm and expressed suicidal ideation. So these are quite alarming figures from a country that's moving towards economic expansion and capitalism, which brings its own problems.
In relation to our national healthcare system, what improvements do you think we should do, and who should do what to improve those?
Well, in relation to mental health, I think it's been part of the national plan in Mongolia since 2002, since the first mental health strategy, to implement community care. And that seems to have been dragging its feet in implementation. So that, to me, would be the easiest and quickest way to improve the mental health access for people. So we've proven in the UK that it can be economically viable. We've done, I was involved in a large program of evaluation for home treatment for people in mental health crises when it was first introduced in the UK, which wasn't too long ago. It was only 1999 onwards that we introduced it. So people who are acutely mentally ill get treated in their own home as opposed to going to hospital. And that, of course, relieves the stigma. For the rest of their lives, they're tainted with the stigma of being in a psychiatric institution. And home treatment alleviates some of that. I think Mongolia is moving towards implementing it, but I haven't seen where the progress is, and maybe it's just that I don't know what's happening, but I would be delighted to see home treatment teams, community teams, community mental health nurses attached to primary care, to GP surgeries, so that people could be treated in the community as opposed to having to go to hospital.
So how does one know if she or he is mentally ill?
Generally, people who don't recognize the symptoms themselves, and their friends and colleagues and family notice more than the person. But if you or I were, say, to become mentally ill or have mental health problems, we would probably find difficulty in working to the standard that we normally do. We might find difficulty sleeping, eating. The normal day-to-day activities would be interrupted in your ability to relate to people. But it all depends on what type of mental health disorder you're suffering from.
Mm-hmm. So how do you think people's mental health well-being is improved?
I think mental well-being is a huge issue globally, and the focus on improving well-being as part of the preventative strategies that are being implemented by the WHO. So well-being can be improved by interacting, making sure that you have a good social network, friends, family, relieving things that cause stress, overwork, and exercise is hugely important, and diet. These are all very basic things that our grandparents and our grandparents before them knew about, but we seem to have lost sight of in the past 50 years. And these all just create a state in the body and in the human mind where you can be resilient and function at an optimum level. It doesn't prevent mental health problems, but it can really reduce the risk of somebody becoming mentally unwell.
So how do you help a friend or family member if you notice there is something going wrong?
Yeah. I think talk to them about what you see and what you observe happening. Ask them how they feel. People are often very frightened to ask somebody how they feel if they are feeling depressed, or they feel it might be rude to comment on somebody's functioning. In the workplace strategies to support people who have mental health problems now should be implemented across all industries, and some industries are better than others, but access to psychological interventions, access to counselling, and generally having a more tolerant and open attitude to mental illness. So somebody can have a mental health problem and then function completely well for the rest of their lives. It's addressing the stigmatization in society that's an issue. But what you or I could do if we saw a friend or a family member being unwell, talk to them first, ask them how we can help them. Do they need to be accompanied to see a doctor or a nurse? And then if they become more and more unwell, then I would contact a doctor or a nurse to come and see them, if possible, and bring them to the emergency department.
I see. Thank you. So would you elaborate for our viewers on the role of mental health nurses, responsibilities and challenges they face?
Well, nurses worldwide form the largest component of the healthcare industry, so they're the biggest part of the workforce in healthcare. And mental health nurses are a strange category because there are people who work in mental health settings looking after people with mental health problems who often are not registered mental health nurses or who don't have training, depending on the regulations in the country, and each country is different. I'm a mental health nurse. It took me 3 years to qualify as a mental health nurse, but in the UK it's different to elsewhere. The responsibilities of mental health nurses range from, depending on the country, day-to-day care of a patient, prescribing, it could be management of a service, it can be directing a hospital. Being part of a team on an equal footing is what we all aspire to, but that's different depending on the country. The problem that we're trying to address in this project that we'll speak about in a minute is the status of nursing in globally. Never mind in Mongolia, nursing is a low-income profession. And that needs to change because we're moving towards a crisis situation in healthcare in that we don't have enough nurses. And in order to encourage people to become a nurse, they have to see something attractive. And who would want to be a nurse if you see it as a low-status profession?
Absolutely. Okay. What can we do as Mongolians to improve such situation?
Yeah, the situation globally, I think we need to make the profession attractive to young people and to people who want to change career. So I think accessing schools, presenting a good image of nursing, encouraging children to think of nursing in the same way they think of engineering, medicine, law, becoming a cameraman, becoming a director in a TV studio. All these people should think of nursing in an equal footing to their own profession. At the moment it's not. It's seen as a feminine industry dominated by women worldwide, and that lowers the status because women are generally in low-income, low-paid professions. So we need more men in the industry, as well as a greater respect and regard. And with respect, of course, we have to change what nurses can do legally in each country, and we have to, in some way, address the hierarchy in the healthcare industry. The old-fashioned hierarchy of doctors being at the top and nurses being at the bottom, that's not modern, and the millennials won't accept that in an industry. Nobody would go into an industry if they think they're at the bottom of it. So nursing needs to be seen on an equal footing with everyone else in the healthcare industry. So in Mongolia, I would say encourage school children to think of nursing, mental health nursing in particular, as respectable, good career with good progression.
That's very interesting and valuable information. Thank you. So, what are the most pressing needs for mental health professionals in Mongolia?
Mm-hmm. Well, I'm involved in a project at the moment, which is around training needs of people who work in mental health settings, nurses who work in mental health settings in Mongolia, and we have received a European Union grant of €1 million to implement this project, and that's based on what's already existing in Mongolia, which are short 3 to 4 month courses for nurses. We're extending it to 6 months to modernise the curriculum, to focus on patient rights in mental health, involving patients in their own treatment, involving them in decisions, and recognising the rights of the family. So in terms of training needs, I think this modernisation and looking towards the developed countries to see what they've done so that Mongolia doesn't make the same mistakes. It took us 20 years to develop these type of curriculum which involve patients and in their care planning. We're now working with Mongolians. We have 3 European countries. We've got Finland, the UK and the Netherlands, with combined efforts, presenting what we have as our nurse training curricula to see how it can be adapted for the Mongolian culture and context, but also to promote the involvement of patients and families in their care. So at the moment I think that that's lacking in Mongolia, and it's one way that we can help.
I see. So you're implementing the best practices of these 3 countries, basically.
Yes. Yeah.
So how long would it last?
Mm-hmm. The project, it's a 3-year program. It started in October 2018, finishes in 2021. So we're halfway through. We're still developing this curriculum with Mongolian partners. We have 3 universities in Ulaanbaatar who are involved: the Mongolian National University of Medical Sciences, Echigan University and Eneral Medical Institute. So the schools of nursing in those 3 universities are combined with us and the National Centre for Mental Health to look have a detailed look at the curriculum and see what can be taken from each country. It's an arduous process and it involves long discussions. We should have a programme ready to implement by October. We've interviewed about 40 nurses to be part of this pilot programme, and most of them will be taken on to start in October. And of those who are taken on, all of them will travel to the EU to observe practice in either Finland, Holland or the UK.
That's very interesting and exciting. You've been engaged in developing research and training programs in Mongolia. What were the highs and lows of this experience?
Yeah, I first came to Mongolia in 2014 and thought it was a one-off visit to see mental health services. I never thought I'd come back again, but I found it fascinating, and I saw practices in the National Centre for Mental Health where people were operating with great kindness and diligence, but with such low resource. They had very little to work with, and the wards they have over 50 patients, and now it's over 70 patients to one registered nurse sometimes. These are numbers that we can't think of in the developed world, and how these people function under such stressful conditions. I was in awe of and greatly respected. So I wanted to come back to see what I could do to implement either research or training that would help. And the highs and lows of the past 5 years coming here, the language, of course, it's very difficult trying to communicate in an industry where communication is the key thing. Trying to communicate through interpreters is difficult. To get good interpreters is difficult, and to build relationships with people when you can't speak to them in their own language. So that's been a challenge. My Mongolian is still terrible, and I'm trying to learn. But the highs were the acceptance of the universities and the healthcare staff of me and of my colleagues coming in before we had any money. It took me 3 years to get this €1 million grant. And they gave their time, they gave their support. So in a way that would have been difficult to find in the UK, we're quite intolerant of people asking for time. But every time I came here, people were supportive and met with me, talked through issues. So that has been really surprising and rewarding, and it encouraged me to keep coming back. So the people who work in the industry themselves, I think, are fantastic.
That's very nice to hear. So when are you coming back to Mongolia, and what's your plan for this year?
I leave Mongolia tomorrow, and I come back in 5 weeks for one of the project meetings. So the 3-year program has it has 7 project meetings of the Finns, the Dutch and the UK partners come to Mongolia to meet with the other universities and associate partners. So the next of those meetings is in March. I think this is my 13th visit to Mongolia, so I come quite regularly, which is very embarrassing that I still don't speak Mongolian. But I think I anticipate being back here maybe 3 more times this year. And I think it's important to keep the project moving forward and to have hands-on knowledge of any difficulties or challenges that my colleagues have on the ground here.
All right. Thank you, Professor Nolan, for accepting our invitation today and addressing on this important issue. We wish you all the best.
Thank you very much. It's a pleasure to be here.
Today we had Professor Fiona Nolan, and our conversation covered mental health care issues in Mongolia. Thank you for staying with us. Goodbye.